Okay, so we're trying to look at what is known as a corrective osteotomy of the radius. Corrective osteotomy of the radius. So for the corrective osteotomy of the radius, it's just all about maybe the radius is short or curved in a way, so you want to correct. Do you understand? So just like the name of the surgery sounds like, it's just, you want to correct something. So it's performed to realign the radius, that's the bone in the forearm. This is when the radius has healed in a way that is not proper. Do you understand? That's the first reason. Second reason, it could be that somebody was just born with a radius that is not aligned the right way. So but all of them, they point towards what? Malalignment. You get? So let's look at the indications properly. If there's malunion of the distal radius fractures, there's sometimes congenital deformities. So there's a way the radius is it's not arranged properly. I think in club hand the radius is like this, like the bone is like this. Do you understand? Like a club that you use in playing golf. Sometimes growth disturbances, sometimes rotation deformities, sometimes painful wrist mechanics or instability. Do you understand? So surgical techniques, what are the different surgeries? What are the techniques they use for this corrective osteotomy? So we have the preoperative planning, where you have to do x-rays, CT scans, 3D modelings. All of them are trying to now look at, okay, let me try to pinpoint what is wrong. So you also decide the type of osteotomy you want to do. Okay, is it an open wedge? Is it a closing wedge? Is it a dome? Or is it a rotational type? Do you understand? All of these are the types of osteotomies that could be done. Then exposure, the surgical approach depends on the deformity location. So at the side of where you want to correct it, you now make the incision. The osteotomy, now you now cut through the radius at the site of the deformity. That's the place that looks like it's an extra bone. So when you cut it out, you now realign the bone. Then you now fix. So internal fixations like the plates, the screws, or sometimes you can use external fixators. You can see here that this is an internal fixator. On x-rays you see this is an internal fixator. You see that this is also the internal fixator that we are talking about. So I'll keep this, and this is widely open. So as this is widely open, the bone will now grow and fill up that place, and somebody will have a corrected radius. Do you understand? So sometimes you can also do bone grafting to fill in the gaps. Then you now close, then you now immobilize the place. So post-operative care is you immobilize for several weeks, then early physiotherapy to restore the motion, monitoring for union with x-rays, then gradual return to function over 3 to 6 months.